I came back to Baltimore this time because I needed to get a kind of like I guess you'd call it like a reconstructive kind of type of neck surgery, just to straighten me back out from my past with my tumor I had and the radiation I had. So.
Stephen's tumor was a 1 in 2 million tumor. We went from neurosurgeon to neurosurgeon to neurosurgeon and took him around the country. And we didn't find out until they biopsied him in August that he had a massive spinal cord intramedullary ependymoma, which means inside of his spinal cord. And it was from the base of his brain to between his shoulder blades. All the neurosurgeons we saw would say, "We'll take it out, we have to take it out, but he'll never be like he is right now. He'll never walk. He'll probably be paralyzed and ventilated."
When Stephen was diagnosed with a spinal cord tumor in high school because of neck pain, the family living in the Midwest sought several medical opinions. All thought it was an inoperable tumor.
They were very, we had doctors that would cry.
They only performed a small biopsy and recommended adjuvant radiation therapy in an attempt to treat the tumor.
It seemed, non-invasive, it seemed helpful. So he went through radiation, he declined dramatically, he was in great pain, his tumor swelled, which there wasn't room for it to swell.
What happened with Stephen was that the radiation did not work. The tumor continued to grow, and he was developing more progressive symptoms, worsening pain and new weakness. The family sought care elsewhere and found Hopkins and found us here.
I emailed him, and within probably 15 minutes he emailed back and he said, "I'm happy to help you."
And after a long discussion with our tumor board, our weekly multidisciplinary approach, we felt that we could help Stephen and his family by safely removing this tumor. Stephen came to Hopkins, and after discussion with the family, we elected to proceed with surgery, and we were able to remove the entire tumor, and we cured him.
After Stephen's surgery last year, we knew that there could be a chance of him developing a disability of his neck falling because he had the radiation and because his tumor was very large, and that volume isn't there anymore. So the bulk of his therapy was strengthening his neck muscles, because basically his neck muscles were trying to do the job that his vertebrae should have been doing it, and it just couldn't do it.
He'll have anesthesia, so his muscles will all be relaxed. And then with x-rays, we'll see if we can, just try to straighten him out. You want him a little straighter than he is now.
He's going to do great.
Yeah.
Thank you.
I'll go see him and say hi.
Okay.
About March or April, Dr. Jallo asked for an x-ray, and when we saw it, couldn't believe that his neck had completely really collapsed forward. Instead of being upright, it was at a right angle. And then Dr. Jallo said, "You need to come. I want you to see Dr. Aim, the orthopedic surgeon." They said, "Yeah, you need this surgery."
I work with Dr. Jallo probably once every other week together. We do a joint case for 2 to 3 times a month. He's a neurosurgeon, obviously. I'm an orthopedic surgeon, and some of our specialties overlap, and we specialize in certain things, and it works out very well together.
I think what's unique about pediatric neurosurgery here at Hopkins is we approach every child, every patient, every disease in a multidisciplinary approach. If one of us in the department is not the expert, we seek out the experts here at Hopkins that can help us take care of each individual patient, and we do it as a team.
Now, we totally expected a really long surgery and a lot more incisions, a lot more work, and he turned out, it's just really miraculous. Originally, they thought they would have to go in from the front. They would have to take out a rib and use that bone for stabilizing the vertebrae. It just worked out really well. The screws held and he looks great.
Thanks. You're still stronger than me, Stephen. That's all right.
Mary and I still want to give you this.
Thank you.
It's always been such an important piece of our
no.
life, and we really consider you part of our family. We just
It makes me feel great. I mean, especially when I can see the long-term follow-up of the children that I operate on. I mean, you know, here, able to remove a tumor in someone that has been given a terminal prognosis saying this is inoperable. I'm able to remove the tumor entirely, tell the family that, and Stephen, that he's cured and that he's going to live a long life and go to college, be able to work and specialize in anything that he wants to do. Yeah, it's what keeps me going.
Dr. Jallo gave Stephen his life back, and I cannot go one day that I see Stephen even walk down the stairs or goof around with his brothers. I really can't go a day without thinking of Dr. Jallo and knowing that he made that happen.